What if I told you that right now, more than 500 million people worldwide are fighting a disease that quietly damages their hearts, kidneys, eyes, and nerves? What's even more shocking is that the numbers are rising, and fast. Today, we're diving into the 10 countries with the highest diabetes rates and uncovering the hidden reasons behind this epidemic. Welcome to Health Hub, the place where we uncover the biggest health challenges and bring you actionable insights to live your healthiest life. If you're new here, make sure to hit the subscribe button and turn on notifications so you don't miss our in-depth health content. In this video, we're not just sharing numbers. We'll explore how culture, diet, lifestyle, and access to healthcare impact diabetes rates and what we can all learn from these countries. Stick with us to the end, because what you learn today might just change how you think about your own health. Number 10, Egypt. Coming in at number 10 is Egypt, where a staggering 21% of the adult population is living with diabetes. That's 1 in 5 adults, a shocking statistic that reveals the growing health challenge in this North African nation. Reasons for ranking. 1. Diet and lifestyle. Traditional Egyptian cuisine, though delicious, often includes high-carbohydrate staples like bread and rice, paired with sugary desserts like basbousa and kanafa. When combined with urbanization and sedentary lifestyles in cities like Cairo, these dietary habits contribute to the rising diabetes rates. 2. Obesity link. Medical research shows a strong link between obesity and type 2 diabetes. According to a 2023 study by the World Health Organization, WHO, Egypt has one of the highest obesity rates in the region, making its population particularly vulnerable. 3. Healthcare challenges. Limited access to preventive healthcare and diabetes education in rural areas compounds the issue. Without early diagnosis and proper management, many Egyptians face severe complications. Impact, the result. Increasing rates of diabetes-related complications like heart disease and kidney failure. Egypt's ranking highlights the urgent need for a nationwide focus on prevention. Number 9, Kiribati. At number 9, we have Kiribati, a small island nation in the Pacific, with a diabetes prevalence of 22%. But don't let its size fool you. This nation faces outsized health challenges. Reasons for ranking. 1. Imported food dependency. Kiribati relies heavily on imported processed foods, often high in sugar and fat. Traditional diets of fish and taro are being replaced by white bread, instant noodles, and sugary drinks. 2. Lack of healthcare access. Healthcare facilities in Kiribati are limited, and many residents don't have access to regular screenings. Diabetes often goes undiagnosed until complications arise. 3. Global warming impact. Interestingly, climate change plays a role here. Rising sea levels threaten food security, pushing residents toward less nutritious, imported options. Impact. For Kiribati, addressing diabetes isn't just about health, it's tied to food policies and environmental sustainability. Number 8, Nauru. Coming in at number 8 is Nauru, where 23% of the population is living with diabetes. This tiny Pacific island has the dubious honor of being one of the most obese nations in the world. Reasons for ranking. 1. Historical factors. Nauru's history as a phosphate mining hub brought wealth, but it also brought imported, calorie-dense foods. Over time, traditional diets were abandoned for processed meals. 2. Sedentary lifestyles. With minimal opportunities for physical activity and a heavy reliance on motorized transport, the lack of exercise is a significant contributor. 3. Cultural practices. In many Pacific cultures, including Nauru, larger body sizes are historically associated with health and prosperity. This cultural perspective makes tackling obesity and diabetes more complex. Impact. The government is making efforts to promote healthier lifestyles, but reversing these trends will require a long-term commitment. Number 7, Marshall Islands. At number 7, we have the Marshall Islands, where diabetes affects 23% of the adult population. This Pacific nation faces unique challenges that make diabetes a pressing issue. Reasons for ranking. 1. Economic challenges. Decades of dependence on U.S. imports have shifted diets from traditional seafood and breadfruit to processed foods high in sugar and fat. This has led to soaring obesity rates. 2. Healthcare struggles. Limited healthcare infrastructure means that many cases of diabetes are diagnosed late, leading to severe complications. 3. Cultural shifts. Urbanization has altered traditional lifestyles, reducing physical activity levels. Coupled with a lack of health education, these changes have fueled the diabetes crisis. Impact. Diabetes in the Marshall Islands is more than a health issue. It's a crisis intertwined with history, economics, and culture. Number 6. Northern Mariana Islands. The Northern Mariana Islands, a U.S. territory in the Pacific, ranks 6th on our list, with 23% of its adult population battling diabetes. That's nearly 1 in 4 adults struggling with this chronic condition. But why are these numbers so high in such a small island community? 1. Dietary transformation. Traditionally, the people of the Northern Mariana Islands relied on fresh seafood, taro, and breadfruit. However, over the past few decades, these nutritious staples have been replaced by imported processed foods like canned meats, instant noodles, and sugary beverages. Research published in the Pacific Health Dialogue Journal found that over 60% of the average caloric intake in the region now comes from highly processed foods. This dietary shift has significantly contributed to rising obesity and diabetes rates. 2. Physical inactivity. Urbanization and modernization have also played a role. Sedentary lifestyles have become more common as physical labor-intensive jobs have been replaced by desk-based work. A 2022 survey from the Pacific Community Health Initiative revealed that 70% of adults in the Northern Mariana Islands do not meet recommended physical activity levels. This inactivity exacerbates diabetes risk. 3. Limited healthcare access. While the islands are a U.S. territory, access to advanced healthcare remains limited, especially in rural areas. Preventive measures like regular blood sugar screenings and diabetes education programs are scarce. This often leads to late diagnosis and poorly managed cases, increasing complications like kidney disease and amputations. 4. Cultural influence. Cultural factors also play a role. In many Pacific Island communities, larger body sizes have historically been seen as symbols of health and prosperity. This perspective can discourage individuals from seeking help or changing their habits. Call to action. The Northern Mariana Islands face a tough battle, but community health programs are beginning to make a difference. Small steps like promoting traditional diets and physical activity can bring big changes over time. Number 5. New Caledonia. At number 5, we have New Caledonia, another Pacific Island nation where 23% of the adult population has diabetes. This French territory faces unique challenges due to its colonial history, socio-economic divides, and evolving lifestyle. 1. Colonial legacy and imported diets. French colonization brought profound changes to New Caledonia's food culture. Traditional Kanak diets, rich in yams, fish, and coconuts, were largely replaced by French bread, pastries, and high-fat cheeses. According to a 2023 study by the Journal of Pacific Health, over 50% of daily calories now come from refined carbohydrates and sugars, driving the diabetes epidemic. 2. Economic inequality. New Caledonia has one of the highest GDPs per capita in the Pacific, but this wealth isn't evenly distributed. Indigenous Kanak communities often face poverty, limiting their access to healthcare and nutritious food options. The World Bank has identified economic inequality as a key driver of poor health outcomes in the region. 3. Healthcare disparities. Despite its status as a French territory, rural areas of New Caledonia struggle with limited healthcare infrastructure. Diabetes screening and management services are concentrated in urban centers like Noumea, leaving many rural residents without support. This contributes to late diagnoses and complications. 4. Rising obesity rates. Obesity is a major risk factor. A 2022 WHO report highlighted that over 40% of New Caledonia's adult population is obese, a direct precursor to the diabetes crisis. Combined with a lack of physical activity, the numbers continue to climb. Hope for change. Efforts are underway to revive traditional diets and promote diabetes education, but New Caledonia still has a long road ahead. A shift toward community-driven health initiatives could pave the way for a healthier future. Remember, if you found this helpful, like, share and write your thoughts in the comment of this video and subscribe to Health Hub. We post fresh, easy-to-follow, research-backed health tips every single day to empower you in managing diabetes and living better. Don't forget to turn on notifications. We're here to support your health journey, because your health is worth it. Number 4. Mauritius. Ranking 4th is Mauritius, where 23% of adults are living with diabetes. This beautiful island in the Indian Ocean is known for its sugar exports, but sugar has become both a blessing and a curse for its people. 1. Sugar's role. Mauritius has a long history of sugarcane farming, and sugar consumption is deeply embedded in the local culture. The average Mauritian consumes significantly more sugar than the global average, according to a 2023 study in the Lancet Diabetes and Endocrinology. Excessive sugar intake is a direct contributor to diabetes rates. 2. High obesity prevalence. Obesity is another critical factor. Over 40% of adults in Mauritius are overweight or obese. The connection between obesity and diabetes is well established, with excess body fat impairing the body's ability to use insulin effectively. 3. Genetic predisposition. Interestingly, genetics also play a role. Research by the Mauritian Health Institute suggests that people of South Asian descent, who make up a significant portion of Mauritius's population, have a higher genetic predisposition to type 2 diabetes. 4. Healthcare advances. Mauritius has made strides in combating diabetes, with free public healthcare and national awareness campaigns. However, lifestyle changes remain a challenge as urbanization and sedentary jobs replace traditional livelihoods. Call to action. Mauritius shows us that even with good healthcare infrastructure, cultural and lifestyle factors must be addressed to tackle diabetes effectively. Number 3. French Polynesia. Coming in at number 3 is French Polynesia, a stunning group of islands in the South Pacific. But behind its breathtaking beauty lies a serious health crisis. 25% of the adult population here is living with diabetes. What's causing such high numbers in this paradise? 1. Dietary shift. Traditionally, Polynesian diets included fresh fish, taro, breadfruit, and coconut. However, colonization and globalization introduced processed foods that are high in refined sugars, trans fats, and empty calories. Research by the Pacific Diabetes Initiative in 2023 revealed that over 70% of daily calorie intake now comes from imported processed foods. 2. Obesity epidemic. French Polynesia also has one of the highest obesity rates globally. According to the World Health Organization, WHO, over 40% of the adult population is classified as obese. Obesity significantly increases the risk of type 2 diabetes by impairing the body's ability to regulate blood sugar effectively. 3. Economic factors. The cost of living in French Polynesia is among the highest in the world, making fresh, local produce less accessible to many residents. Instead, families often rely on cheaper, calorie-dense foods, further exacerbating the diabetes epidemic. 4. Healthcare accessibility. Despite being an overseas territory of France, access to specialized diabetes care is limited, especially in remote islands. A study from the Polynesian Health Institute found that many cases of diabetes go undiagnosed until severe complications arise, such as kidney failure or amputations. Impact and hope. Efforts are underway to address this crisis, including campaigns promoting traditional diets and regular exercise. But reversing these trends will require a collective effort from policymakers, healthcare providers, and communities. Number 2. Kuwait. At number 2, we have Kuwait, where a staggering 25% of the adult population suffers from diabetes. This wealthy Gulf nation has one of the highest rates of diabetes globally, driven by a combination of lifestyle factors and cultural shifts. 1. Sedentary lifestyles. Kuwait's rapid economic growth has brought immense wealth but also significant lifestyle changes. Sedentary habits dominate, with most people relying on cars for transportation and spending long hours in office jobs or air-conditioned homes. A 2022 report from the Gulf Health Council revealed that over 60% of Kuwaiti adults engage in minimal physical activity daily. 2. Diet high in sugar and fat. The Kuwaiti diet has shifted dramatically over the past few decades. Traditional meals like grilled fish and fresh vegetables have been replaced by fast food, sugary desserts, and calorie-dense beverages. According to a 2023 study in the Journal of Diabetes Research, the average Kuwaiti consumes nearly double the daily recommended sugar intake. 3. Genetic predisposition. Genetics also play a role in Kuwait's diabetes epidemic. People of Middle Eastern descent have a higher genetic predisposition to insulin resistance, making them more susceptible to type 2 diabetes, especially when combined with unhealthy lifestyle choices. 4. Healthcare system. While Kuwait boasts a well-funded healthcare system, the focus has traditionally been on treatment rather than prevention. This approach has led to high rates of complications like diabetic neuropathy and cardiovascular disease. Government initiatives. In recent years, the Kuwaiti government has launched public health campaigns to promote awareness and encourage healthier lifestyles. However, the challenge lies in changing deeply ingrained habits in a society accustomed to convenience and indulgence. Number 1. Pakistan. Finally, at number 1, we have Pakistan, where diabetes affects a shocking 27% of the adult population. That's more than 1 in 4 adults struggling with this chronic condition, making it the country with the highest diabetes prevalence in the world. 1. Dietary habits. Traditional Pakistani diets are rich in carbohydrates and fats, with staples like rice, bread, and deep-fried snacks dominating meals. Additionally, sugary beverages and desserts like gulab jamun and jalebi are widely consumed. A 2023 study published in The Lancet Diabetes and Endocrinology highlighted the significant impact of these dietary patterns on rising diabetes rates. 2. Obesity and physical inactivity. Obesity is a major contributing factor in Pakistan's diabetes crisis. According to the Pakistan Health Research Council, nearly 40% of adults are overweight or obese. Coupled with low levels of physical activity, especially in urban areas, these factors are driving the diabetes epidemic. 3. Urbanization and stress. Rapid urbanization has not only changed lifestyles but also increased stress levels. Chronic stress is known to elevate blood sugar levels, contributing to diabetes. With over half of Pakistan's population now living in cities, this factor cannot be ignored. 4. Healthcare infrastructure. Pakistan's healthcare system faces numerous challenges, including underfunding and unequal access. Rural areas, in particular, lack the facilities needed for early diagnosis and effective management of diabetes. A 2022 report from the International Diabetes Federation revealed that nearly half of all diabetes cases in Pakistan remain undiagnosed. 5. Awareness campaigns and challenges. While awareness campaigns are gaining traction, cultural and social barriers often prevent people from seeking help. Many view diabetes as a condition that can be managed with home remedies, delaying proper treatment. A national emergency. With diabetes-related complications like heart disease and kidney failure on the rise, Pakistan is facing a public health emergency. Addressing this crisis requires a multifaceted approach, including better healthcare infrastructure, public awareness, and lifestyle changes. Global lessons and hope. As we counted down the top 10 countries battling diabetes, we uncovered striking patterns. These aren't just isolated health crises, they're global lessons that carry hope for change. Lesson 1. Diet and nutrition matter more than ever. In countries like French Polynesia and Kuwait, we saw how rapid adoption of processed and sugary foods replaced traditional, nutrient-dense diets. But here's the hopeful part. Communities that return to traditional diets, like whole grains, fresh fruits, and lean proteins, are seeing improvements in diabetes rates. Studies from The Lancet confirm that even small changes in daily diets can reduce the risk of diabetes by up to 50%. Lesson 2. Active lifestyles are a game changer. From New Caledonia to Mauritius, one common thread was clear. Sedentary lifestyles combined with urbanization are fueling the diabetes crisis. The good news: physical activity doesn't have to mean hitting the gym. A brisk 30-minute walk, as supported by research from Harvard Medical School, can significantly improve blood sugar control and prevent diabetes. Lesson 3. Access to education and healthcare saves lives. Countries like Pakistan show us how lack of education and medical access exacerbates diabetes complications. However, global initiatives like the International Diabetes Federation's Bridges program are helping bridge these gaps, offering free screenings and educational workshops. Imagine the impact if every community prioritized early detection and prevention. Lesson 4. Small changes lead to big outcomes. Perhaps the most inspiring lesson comes from grassroots efforts. Local communities introducing wellness programs, healthier school lunches, or workplace fitness challenges have shown remarkable results. It's a reminder that change begins at the community level and grows outward. Closing on hope, the diabetes epidemic may be daunting, but as we've seen, it's also preventable. By sharing knowledge, supporting each other, and making small lifestyle shifts, we can create a future where diabetes rates decline instead of rise. Conclusion with call to action. As we wrap up, let's reflect on what we've learned. Diabetes isn't just numbers on a chart, it's real people, real families, and real lives impacted every day. But this story isn't set in stone. With awareness, action, and hope, we can rewrite it. If you found this video insightful, let's spread the word. Share this with friends and family, it might just save a life. Don't forget to like this video to help it reach more viewers and subscribe to Health Hub for more life-changing health insights. The top 10 countries battling diabetes have taught us valuable lessons. But remember, every small step counts. Whether it's swapping a sugary snack for a piece of fruit, taking a walk after dinner, or encouraging a loved one to get screened, your actions matter. Thank you for watching Health Hub, where health meets hope. Together, we can take a stand against diabetes and create a healthier world for ourselves and future generations. See you in the next video.